I've seen most of the babies who are born, they have the white thing,
on the neck,
on the neck, and the
you just want to remove it. Behind the ears,
behind the ears, on the nose,
and the girls around their
the labia. It's called vernix. It's usually good. It's a protective of the skin. It prevents skin from bacteria. It keeps the skin warm. It keeps the skin moist. So it's like actually oil for the baby.
When you're breastfeeding, you prevent a lot of problems. So make sure you take time. It can be tiresome, yes, but take time to breastfeed. Even if it's expressing and giving that breast milk, it will prevent a lot of problems.
Hello there and good morning. My name is Frida Wasonga and I am so happy to host these parenting conversations. I hope that you've been watching and learning one or two things from the shows, as each parents have talked about their stories, and also as we've been hosting specialists to talk about different topics concerning parenting and children. Today I am super excited because I am hosting people that you have asked for. You will get to know when they introduce themselves. So sit back and enjoy the show. I would also want to know how you will find the video at the end. So please comment on the comment section, ask your questions, and let me know how you find the video and what your takeaway will be. So at this juncture, I will allow my guests to introduce themselves and tell us what they do on a daily basis. Karibuni sana to the show. Please introduce yourselves.
So my name is Purity Karanja. I am a nurse, midwife, and it's been a journey. And currently I'm working as a nurse midwife.
Okay. For how long have you been a nurse, a midwife nurse?
I think this is the 8th year. Wow.
Okay.
My name is Angela Kadhomi Kibara. I'm a nurse midwife by profession. And like she said, 8 years of being a nurse midwife.
Okay. So take us back to why you chose to be a nurse. What inspired you to be a nurse and not a pilot or an engineer?
Okay. When I was growing up, my mom had scenarios where she could be admitted. And when I was completing the high school, I had two choices, either to be a teacher or a nurse. So I had taken the path of a teacher, but before finalizing, an opportunity came, and that's how I joined the nursing school.
Okay. How about you, Angie?
I wanted to be a doctor at first. Me and mathematics, we were not so good friends. But I don't say all nurses don't know mathematics. They do. So I just wanted to be in the medical profession. And I admired being in the medical profession. And after high school, I joined a discipleship program. We went for mission somewhere in Garissa. And we were told to choose either to help in the school to be a teacher or in the dispensary to help the nurse, and I chose the dispensary. I helped the nurse out, and I think the passion grew from there. And after that, I enrolled to School of Nursing. My parents were quite supportive of it, and that's how I got married into nursing.
Wow. Okay, so how was school, Angie?
School was pretty much fine. I studied for 3 years. That was from 2012 September to 2015. Around August, September. Challenges were getting to the anatomy, the physiology, and having everything in mind. And as unlike university, with college is like another secondary school. We didn't have time for socializing or going out, maybe once in a week, because nursing you're trained from the word go, that a day is like a weekend is like a weekday. So as we used to train and still go to the clinical areas in the hospital, so we would get only like a one-off day. in a week. When we were in classes, we'd get only the weekend off. So maybe you go home, you come back. There was signing in. You couldn't just go home anytime you want. So there was signing in and signing out. There were rules. Let me say just there were rules because nursing is a profession. We have to work with rules. We have to work with policies because we are dealing with lives. So for me, that wasn't so much of a challenge because I was not a social person. So I blended in with it well. Yeah, I could say that much about school.
Okay. Did you feel like quitting at any point?
No. I didn't feel like quitting nursing. I enjoyed every moment. Yeah. I didn't have any expectations when I was getting into nursing. So I just flowed. Nilienda na mteremko. Nilienda tu. I mean, I married it married me, and tulisikizana. Yeah, unlike high school. High school is when I felt like quitting because it was my first time in boarding. Koga na maji baridi. I was so far away from home. So unlike nursing, I think I enjoyed every bit of nursing.
Okay. How about you, Piviki?
The experience was good. And I would say there was a very big difference between high school and college.
Okay.
There was a bit of a freedom, that free time. So the transition, first of all, I got surprised that you are own management somehow. Provided you abide to the school rules and regulations, you finish your assignment on time, you make sure you show up on time when you are supposed to be on duty. Sometimes, the hardship part, I would say, when you are revising maybe for the exams, because you are given like only three trials, you should not fail the third time. So the first trial, you have to make sure you make it so that you can pass all of you as a group. Because if you fail, that meant you would go back to revise on your own. So that is where the tension could come in. But after that, I would say I really enjoyed the clinical moments because there was so much freedom.
Okay. So how is work now as a midwife?
Generally, I think nursing is quite involving, both mentally, physically, emotionally, because if you're not at work, you're home resting, sleeping, and before you realize it, it's time to report for your next shift. Yes, I think it's generally involving.
And Pretty, how would you describe your job?
There are different days, and sometimes it can be exhausting because of that parent fatigue. Sometimes you can have very busy shifts, and then sometimes there are easy shifts as well. But again, being a nurse, you are totally isolated from the social life. Because most of the times mainly when there are public holidays, you are working, and then when it is not public holidays, other people or other cadres, they are at work. That's your off days, and when the other people go to off, they don't ride. So you live a kind of isolated life. But it is a good profession. You enjoy. You really enjoy, especially you have good outcomes, you feel happy, and there is satisfaction.
Is that the reason why we hear nurses marry among themselves? Or either they marry doctors? Maybe from your own experience, is it practical? Did you get one from your own circle?
I didn't get one, but the probability of getting married to someone from medical field is very high because that environment it's where you are almost all through
all your life. And those now become your friends. And Angie, you're not like her.
I got married to a person from the medical field. Like she said, it's true because the probability is high because most of the friends you have are from the medical fields. you get to understand each other better.
Okay. So how has motherhood been for you as nurses? Maybe before we now go to handling nursing specifically, how has motherhood been?
Motherhood with nursing, you have the advantages and the disadvantages.
And the advantages should be you already know what to expect.
Yeah, okay, people assume or presume that maybe we know what to expect and all that. But now the problem comes in when we overthink. The problem could be small. The child could be having just a cold, but you go and say this child needs a CT scan, maybe has meningitis, and maybe it's just a cold. So if you have, they say too much knowledge is also dangerous. So if you have this too much knowledge, you panic more and become anxious more, just like unlike a lay person who can just take it as a cold and treat it like that. But also the advantage of being a nurse and a mother is you can notice any sign as early as possible, and you are able to intervene.
Okay. So let's now go to the first question that was asked by our viewers to the nurses. What is normal for a mother with a newborn? What should they look out for when they go to hospital at that point of delivery?
Okay, at birth, apart from the normal things like 2 eyes, 1 nose, 1 mouth, yes. For you to know a baby is normal, it will take the milestones. You have like a month or 2 or 3, because if at least at 3 months, if the baby is not sitting, if the baby cannot hold the head straight, but at birth you have to just check if the baby is intact, if the baby has 10 fingers. Those are the things to locate on a newborn. Then after that, maybe when you go home, we call them danger signs, but these are just to show if the baby is not well, not sick. Maybe yellowness, we call it jaundice. Maybe if the baby is not breastfeeding, the baby has fevers. Babies cry, but there is that crying which is irritable. Even your instincts. I think mothers are also, we got some favor from God to have some instincts. You know, a baby will cry, but you know this cry is not the normal cry. They are continuous, irritable cry. Those are the things to check out once a mother is discharged from the hospital. But when we go to hospital, we're usually issued with the antenatal booklets. They usually guide us on after every 2-3 months what to watch out from a baby, and to know if the baby is growing well, the milestones. And one of them is like at a certain, I think 3 to 4 months, if the baby is not able to hold the head up, you should be worried. At around 5 months, if the baby is not able to sit alone, you should be worried. Maybe not able to make sounds, but you'll able to know a baby is not okay or deviating with the milestones, not exactly when the baby is instantly born. Apart from now the normal, how a normal human being looks like.
And the crying immediately after birth?
The crying should be there. And that's what, as midwives, we used to score a baby and tell if a baby is ako sawa, amezaliwa vizuri. It's something called the APGAR score, which was recorded at the 1 minute of birth, the 5th minute, and the 10th minute. And the crying usually helps because once the baby cries and opens up, air now enters into the lungs and it's circulated to the brain. Because when the baby is in the womb, most of the circulation and breathing, they go hand in hand. It's like the mother does it for the baby. But once the baby is born, when the baby cries, the lungs open up, the air is, the water, there's usually some water in the lungs is displaced, the baby starts crying, and when the baby starts crying, circulation occurs and the baby becomes pink, and so that first cry is usually important in a baby.
You said the baby becomes pink?
Yes.
Initially, when they are born, they are what color?
The bluish. The color bluish, not really grayish, a bluish, which means there's a limit of oxygen supply. But when the baby cries, the lungs open up, supply of the blood continues and oxygen.
Yeah.
Even if you look at yourself now, if you pinch, utaona some pink.
You're pink, yeah.
Yes, so the baby turns from blue to pink. That's why mothers are advised, even if they go home, when a baby chokes and they turn blue, it's a danger sign. Yes, when somebody turns blue, it means there's no oxygen.
There's no oxygen in the body.
Yes.
Okay. All right. And for you, Purity, so explain to us now the APGAR score. I would like to know more, like at minute 1, what should it be? Do you score it out of 10 or out of 5? And then what is normal and what is not? And do you tell parents also about the APGAR scores of their children?
By the time you decide whether it's a normal baby, you have to wait up to 10 minutes.
Okay.
But mostly, if you need to take action, you take it maybe by the 5th minute. But 1 minute, at 1 minute, it is too early to judge this is not a normal baby. So the first one she has said, it's the appearance of the baby.
Okay.
Is this baby pink or dull?
Yeah.
Dull baby, or that blue, if you can check, is that bluish color.
Yeah.
The other one is the pulse. Pulse, it's heartbeat.
Okay.
You check the heartbeat of the baby.
With your hand or with an instrument?
You can check with stethoscope, or you can do with your hand. When you feel here at the cord, you feel the pulse.
Okay.
So if it is strong, it is strong above 100, that is a good baby.
Okay.
If it's below 100, you need some interventions, and if it's too low, below 60, you need to act quickly to help the baby have a good heartbeat.
Okay.
The other one is the respiration. You check the baby, is this baby breathing? So you can check if there is no rising and falling of the chest. You can see if the baby is not breathing, then you put measures to assist the baby breathe. Yeah, so you give baby oxygen.
We call it stimulating.
That's slapping is called stimulating.
Yes.
Okay.
Yeah, so you stimulate and try to see if baby will breathe. And those activities happen like at the same time. You stimulate, baby cries, a strong cry, breathing. So the other one is the reflex. How is this baby moving? How are the movements of the baby? They are supposed to move their hands, legs, their extremities. Yeah.
Okay.
So if it's just a flop baby, floppy, we are not moving, then there is a problem.
So the baby should move, maybe kick or...
Yes.
Okay.
So out of each has 2 scores.
Okay.
If there is none completely, you score 0.
Okay.
So you check for what is not there. You don't check for what is there.
Oh,
you check for what is not there.
Yeah.
So if you find something is not there, or like that one for the parts is there, is it above 100, below 100? Below 100, you score 1. Above 100, 2.
Okay.
Each score has 2.
Yeah.
So that sums up to 10.
Okay.
Yeah.
All right.
So you'll hear baby scored 8, 9, 10. That is at minute 1, the baby had 8 scores.
Okay.
At minute 5, baby had 9 scores. At minute 10, when you now have a proper judgment for this baby, has 10 scores, and anything below 7, that is a critical baby.
Okay. Yes. That means there is one that was scored 0. That's why they have a 7.
Or some which had 1.
Yeah.
Yes.
Okay. Up until minute 10.
Yes.
Okay. So where is the mother all this time? Because you don't explain to us. You just take our babies, you start slapping them, and we don't know what
we are slapping them up.
We don't understand, so we just wonder, what? So explain to these mothers as you do that, where are they?
As we do that, if it was a normal delivery, you'll find that moment is when the mother is being taken care of. The delivery of the placenta, those things, they occur concurrently. So a baby is given to the pediatric team, and then the mother remains with the obs-gyn team.
Yeah.
So they happen at the same time.
I see.
You
Yeah,
see?
yeah.
So you can, okay, the mother is being taken care of so that she doesn't bleed, the placenta is being delivered, but after all that, the mother is appraised of everything that has happened. How is the baby? If the baby is okay, they'll start boarding immediately.
What is boarding?
Or
bonding.
Yeah, bonding.
So you put the baby on the
on the breast actually.
On the breast.
Yeah, they can start feeding. If it's a CS mother, that is in theater.
Yeah.
Normally there is a gap because where the mother is being worked on is a place you cannot contaminate.
Okay.
Yeah. Maybe if mother was not put to sleep completely, you can take baby and show mother the gender to identify. But if it was maybe urgent emergency cases, mother is completely asleep. Now that one, there is a gap there because you go with the baby and then you wait for the mother when she comes to the ward.
6 hours later.
That's really
2 hours.
Like 1 hour.
1 hour 45 minutes.
So I think it's just a long time. Like you deliver at 7 and you get to see your baby at midday.
Unless there was somewhere there was a problem.
Okay.
So that's when they come to bond after.
Okay.
But for normal delivery, they do it immediately.
Okay. Do you advise fathers to go into the labor room?
For that, we leave it for the couple to decide.
Okay.
There are men who want to come in, but personally, I would. My take is maybe they would just stay outside there, pray for the wife and hope for good things, because you see this person is not exposed to such an environment, and maybe it could first time it could traumatize them. But some you feel like the wife needs the husband more at that time so that she can get the energy to deliver, which is okay. We allow the husband to come in, but on the head, this upper side of the mother's body and not on the lower side of the mother's body. And some women, when their spouses are there, they really get actually encouraged a lot, and they are able to do that. So that we leave it between the couples to decide. Yes, but it's usually allowed.
Has there been a case of in your experience when the father got traumatized?
We can't know as per that very moment. They just go quiet, but I think it comes back later.
Do they faint?
I've never seen anyone fainting so far. I'm yet to see. Yes.
Okay. There's this notion that the checking of the centimeters is very intrusive. Is there a way AI can help, or technology maybe, to come up with a different way of not intruding into people's privacy?
Unfortunately, I don't think so, because the baby comes through the birth canal, through our vagina, and that's the birth canal. And the only way to know if if the mother is progressing, if it's safe for the baby, if the baby is okay, that's the only way to know, through the birth canal. And for actually to reduce the numbers, the number of times a woman can be checked, that's why we say within a repeat vaginal examination after 4 hours, or if need be, because once maybe the water breaks, we have a risk of maybe the cord prolapsing. We have to know how far this mother is, so we have to check. When you come from home, you say you're in pain, we have to check so that we can know how to actually manage you and the baby. We also have to check to know which part is presenting. Is it the head? Is it the legs coming out first? So that we can actually intervene. But now, it's usually, it's like the way you say, an intrusion of privacy. It's scary, it's kind of intimidating, but once the midwife reassures the patients, most become cooperative. And once you become cooperative, also the muscles relax, and it's a quick thing, and we are done. But technology can't. Even if technology would, there's still something that has to be put in there so that to see. You see,
at least not fingers.
Something has to, and actually those other things that will be put there, maybe they may be even worse.
Yeah.
You see? Yeah.
Okay.
Yeah.
So is there a measure, maybe for a new mother, we are not scaring you new mothers, please, but can you just show maybe what is the length of 2 centimeters and
2
6
centimeters.
Maybe purity.
That's tricky. Because now you use your fingers to check. There is a way you think, and the way you are checking
what you
can feel.
Okay.
So it's the judgment. So when you put your fingers, now one finger is like 1 centimeter.
Okay.
1 centimeter. If you can, when you hear the terminology, the tip of a finger, one finger cannot go through completely.
Yeah.
If you can put completely well, so that is 2
centimeters.
Yes. If you can manage to put 2, and this other one, the second finger cannot go through well, that's around 3. If you can put 2 well without any strain, that is 4.
Okay.
So you go judging the way the mother is progressing. Again, you can be examined by different people, and there can be a difference depending on the sizes of the finger. They are not the same. You can hear a difference of 2 or 1 centimeter, which is okay. And by the time the mother is ready, that cervix, you cannot feel it, or it is all round completely. You cannot measure. It is completely
It's a hollow
round.
space.
Okay. Okay, and then that's when you now advise them to maybe go and Okay, I think that's sufficient. And how now should, when a newborn comes, how should now a new mother take care of not even a new mother actually, all mothers, how should we take care of a newborn? Terms of maybe cleanliness, what to check out for, like you told us, Angie, that the milestones, what is normal when we go home with the baby, and how should our husbands help at that point so that we rest also.
Okay. So we'll start with taking care of the newborn. Breastfeeding, please breastfeed every 2 to 3 hours or on demand. The 3 hours are not over and the baby is awake and still wants to breastfeed. You breastfeed. Changing of the diapers. Every time before you breastfeed the baby, at least you check the diapers, so that if it's wet, you change it so that the baby cannot asichomeke with the poop or the sus. Baby's clothes should be, we say we wash them at least separately, because when they are new, their immunity is not well built up, their immunity is not strong, so they are really delicate. So they have their own, their clothes are washed alone, they have their own basin and buckets. We said of the things to check out when the mother goes home. The baby starts turning yellow, the baby has fevers, so at least by the time you are being discharged, or by the time you are preparing to have a baby, at least you should have a thermometer at home. So you check for fevers, and fevers, we say that it's a temperature of 37.6 and above. Yes. Fevers, yellowness, if the baby completely refuses to breastfeed, that's a danger sign. It means maybe the baby is ailing or something is wrong.
So what should we do?
Go to the nearest hospital. Seek medical attention.
Not to start giving
a meal over the counter. No. If you're not sure, if you're not sure what to do with the baby, the best thing is it's better to go to the hospital and be brought back home than to hear advice of very many people. You don't know, you hear many advices, you don't know what to choose to do or what not to do. And babies really change condition very fast, and they can't talk. They're not like grown-ups, so they won't say ninasikia hapa na hapa. And when their condition changes, now it becomes worse, and it's a matter of time. So if you're not sure of what is happening with your baby, instead of going to get over-the-counter medications in the chemist, just take the baby to the hospital to be seen, and then you'll be advised.
Any addition, Pretty, how to take care of the nipple?
On top of that, I think the mother should be very keen on the diapers, counting the diapers every 24 hours. Like for babies who are born the first day, at least you should have one wet diaper.
Okay.
Yeah. The second day you should have at least 2.
Okay.
That day 3.
That means poo or just
Susu.
Okay. Yeah.
Susu is very important.
Okay.
Yeah, so that if this baby is having dehydration, the first sign or the first thing that will not be there is the susu. So susu tells you this baby is well hydrated. Yeah, so every day by the 6th day, you should be having 6 wet diapers. They should not go backwards. You are getting 6 in 24 hours by 6th day, then you start having 3 diapers. There is a problem.
Okay. Yeah.
So the cord, mothers should be keen on the cord. With the cord care, it depends now with the institutions. The institutions which use the MOH guidelines of chlorhexidine, there are some which use surgical spirit.
And others water.
And others water. Hot water, but I think that one is outdated now.
Oh, it is?
Yes.
Okay.
So the mother should take care of the cord, at least wipe it twice a day, and watch out. It should it turns black, it starts becoming hard, then it falls off. But when you see pus coming out of it, or any redness or bleeding, now that becomes a danger sign. Yeah. So cord care should also be one of the things to look. We give it the cord is given up to 14 days to fall off by itself. Even after falling off, you still continue wiping the cord area. Even mothers should not be afraid of wiping the area. It's not painful because the tissue is actually dead. It's not a live tissue, and you'll get the baby cringing because of either the wetness of the spirit, or they just don't want to be disturbed, but it's not because they are feeling pain. So you find many mothers fear wiping the cord that the baby is feeling pain, but the baby does not feel pain. And if you don't wipe it correctly, now is when infection starts coming.
So when there is pus, we still go to hospital.
You go to hospital. You run.
We run. Okay. How about wiping girls?
Front to back, just as the way we go to the toilet. Front to back. You can use wet wipes or cotton wool with warm water. Yes.
Okay. There is a case that I had here.
I've said front to back. Yeah, front to back.
There's a case of a child a newborn who got UTI. UTI to me looks like a grown-up's problem. Where do newborns get UTI from?
It is possible because if there is mix-up of poop coming to the front side, that's a risk.
At delivery?
At delivery or after a few days, immediately after delivery.
Okay, let's say maybe the first 10 days.
So when you are wiping them, you make sure it is front to back, and then you maintain hygiene. Just hygiene, maintain basic hygiene. That will prevent a lot of problems.
And baby bathing, after how long should babies be bathed?
The WHO guidelines now recommend after 24 hours.
Okay.
But also to find it will depend with institutions too. Some wash after 48 hours, some after 72. But the delaying of the birth is really good for the newborn, because one, it helps them maintain the temperature. Because if you've seen most of the babies who are born, they have the white thing,
on the neck,
on the neck, and the
behind the ears,
behind the ears, on the nose,
and the girls around their
the labia. It's called vernix. It's usually good. It's a protective of the skin. It prevents the skin from bacteria. It keeps the skin warm. It keeps the skin moist. So it's like actually oil for the baby.
Okay.
Yes. So if you delay the birthing of the baby is still safe, And also it's the delaying of the bathing of the baby helps in drying of the cord. Because once the baby is put in water, the cord still gets wet. So it also delays the healing of the baby. So I would tell newborn parents not to rush in washing the babies. They can stay up to 72 hours, but you can wipe with this oil. If you feel the white things are too much, the baby oils you can take in a cotton wool or a soft face flannel, then you just wipe. The baby looks presentable a bit.
And the smell. Okay.
That one about checking what is normal, I would urge the mothers, the new mothers, either conservative or new mothers, formula is there and it is available. And everyone can afford formula.
Are you sure?
The highest number can. When you're breastfeeding, you prevent a lot of problems. So make sure you take time. It can be tiresome, yes, but take time to breastfeed. Even if it's expressing and giving that breast milk, it will prevent a lot of problems.
Okay.
Yeah. So when you breastfed baby, it's not like a formula-fed baby.
Okay.
We are completely different.
Yeah.
Because the breast milk has so much of the nutrients, everything. It has all the components.
Please tell us more about it. So
but now for the formula, it's like supplementation, but it cannot cover like a breast milk 100%. So they are still missing components. So I would urge moms to, you'll get tired, fatigue, but it is very important. Again, it could go well if the transition phase happens even before you leave the hospital.
What is transition phase?
That moment you did not have a baby.
Yes.
But now you have delivered a baby.
Yeah.
Now you see this a new phase. You are starting for you and baby. Unlike when the baby was in the womb. So that moment is when you should take much of the time. Breastfeeding, in the hospitals, the mothers will request for formula, it will be given, but you miss that chance of bonding and breastfeeding. It will be an easy time, but when you go home, now it turns to be a very rough time because the transition, there was a gap in transition. You did not bond with the baby immediately, and you did not take time. So when you are home and you are alone, that is when you realize, I don't know how to do this, I don't know how to latch. It gets overwhelming. But if you can ask maybe the nurses, the midwives to assist you to get it, get that concept immediately, it will be easy at home.
So you're saying immediately the baby is brought either to a normal birth mom or a theater mom, you should first of all latch the baby.
You latch the baby, you get used to that process of feeding baby, making sure baby is well fed, a baby is full, because that will also prevent complications like engorgement.
What is engorgement? Maybe someone doesn't.
A lot of when the milk is not, when it doesn't come out completely, production will be there. But now it's being produced, but it is not coming out. So it gets packed in the milk duct. And that will bring infections.
Mastitis.
Yes, mastitis.
You don't call it mastitis, that's why you're looking at each other.
It starts with engorgement and then it proceeds to mastitis.
Okay. Infection first and then mastitis.
Yes. Okay. So there are things that you could have prevented before they get to a situation.
Okay, so probably you can explain to us how latching is done, and then also tell us if someone discovers that they are engorged and it's extremely painful, like it happened to me at some point, and I didn't know what to do.
So latching baby, there is a way of latching. how you hold baby should be tummy to tummy. Your tummy and baby's tummy should be at the same point.
Okay.
And then you make sure the most of the dark part is in baby's mouth. There is no gap there, or you should not feel sounds there when baby is breastfeeding. Because if you hear the sounds, that means the attachment is not good. So you make sure the attachment is good, and then when you are latching, make sure it's 20 to 30 minutes each breast.
Oh.
Yeah.
And the babies will sleep 5 minutes into breastfeeding.
You keep
waking and you reduce the clothing of the babies. You don't overcover the baby. The baby will feel warm
and
then sleep.
Okay.
So you make sure the numbers of clothes are reduced. At least one foot is out, you tickle it, or at the edge of the ear. When they take a pose, you remind them like this.
It's time to eat. For us, you see the baby asleep and you're like, Fuchs, sleep.
But now the problem is the baby will only feed 10 minutes, sleep for 1 hour, wakes up again, so you keep doing the cycle and the mother gets tired. Then another thing in latching and breastfeeding, you make sure first you're in a very comfortable position, the mother, because if you're not in a comfortable position, you also get tired faster than the child. You'll say the child is full and it's actually you who's tired.
Exactly.
So you get a comfortable seat, always support the back. These days at least there are those breastfeeding nursing pillows. They really help. If it's a cup of chocolate or uji, let it just stay there near you. So at least you keep refreshing yourself as you feed the baby. As she has said, tummy to tummy. The head should come at this joint of the elbow.
Okay. And they hold that. But sometimes the baby's mouth is too tiny, and the please show them what to do, because sometimes the baby's mouth is too tiny and the nipple can't fit. So you just and then when it gets in, it's extremely painful because of the crack.
The baby just latches on the nipple and it becomes sore and it becomes a bit painful. So when the baby is opening the mouth, you can help extend the mouth by pinching the chin a bit down. And also even when the baby has finished breastfeeding, don't just pull your breast out. It's also, it can make you get the cracked nipple. So you also you pull the chin down so that the baby can leave the breast there.
Okay, that's helpful.
Then with engorgement, engorgement can also occur to even those mothers maybe who actually breastfeed on time and everything, just because the milk supply is too much. So what we usually advise mothers, get a breast pump. As you're preparing for delivery and new child, let the breast pump be part of your list. Just as the thermometer is part of your list, the baby clothes are part of your list, get a breast pump as early as enough. So that once the baby has already breastfed, you put the baby down, the remaining milk you can pump.
Or when the baby breastfeeds on one, you can pump the other one.
But that could be a bit tiresome. So once maybe you've laid the baby down, pump. Maziwa haitaisha. Many fear that when they pump after, when the baby wakes up, hata. But production of milk is a circulation. It's a continuous process. So milk will not end. So after that, you just pump. That helps with dealing with the engorgement. Yes, especially the first 2 weeks. Those are the times mothers really get engorgement. So after baby has breastfed, you just pump the remaining milk. Yes.
And you pour it?
No, you don't pour it.
It's gold.
It is gold actually. Maybe for the working moms who usually return back to work after 3 to 4 months, you can start storing. So you get these milk storage bags or milk containers. After you have expressed, you label it. You label it the day and the time and put it in the freezer. Breast milk can stay in the freezer for up to 6 months. So it's still safe. It can stay in the freezer for up to 6 months, in the refrigerator for up to 24 hours, I think out of the refrigerator for 6 hours. Yes. Then when you maybe even during that time, maybe after a month, maybe you might even decide to go to the market. The baby is left alone home. That expressed milk can be used to feed the baby at that time. Yeah.
So that you don't hurry up to come back.
Yeah. So we usually encourage mothers not to wait up to the 3rd month when they're almost going to work, so that start expressing. You just start expressing from day 1. You reach home. Yeah. Just express. Even if it's 30 mls, 40 mls. No little is little for this child, because breast milk is gold to every child. Yeah. Yes.
Okay. So some may say maybe the yellow one should not be stored. It's looking very bad.
That's the one which is the best. Kona mafuta. It has those proteins. Hiyo ndo itanonesha mtoto.
Oh, okay.
Yeah. But also, as you continue to express, the first milk looks watery. That's also very good milk for the baby.
Actually, because people say that I didn't have milk, I just had water, so my baby was not, of course, mom told me my baby is not full, that's why they are crying, and so I gave Uji.
that transparent milk is still milk. That white milk is still milk. Yeah. That yellow milk is still milk. Yeah. So anything that comes out from the breast, it's still milk. Yeah. Yes. So consider all that still precious to this little one.
So let's respond to some of the stereotypes that people say about nurses. The first one is about actually breastfeeding, that you guys are not very patient, especially with the new moms. At that point when they are engorged and you want to pull their nipples, let me see if you have milk. Or now someone doesn't know how to latch and you're like, oh, you don't want to, like, nurses are not kind. Please respond to that so that people know that if it's true nurses are unkind or actually nurses are helping.
One thing that happens, nurses are judged from my own experience. Everything you do from a point of you want to help this mother. Yeah. And the only way to heal that engorgement or to assess if there is milk, the only way to heal engorgement is that milk to come out. Yeah. There is no any other way. Yeah. So if it doesn't come out, the engorgement will proceed to mastitis, even a bigger complication. Yeah. Mastitis, the mother, you find some mothers, because that milk now it is too thick, others will land in theater, you see, for surgery, so that now abscess can be drained in theater. So sometimes we try to be patient. But the process, even for ourselves, when we get babies, it is not easy.
It's the same.
It is the same. Yeah. You feel pain, but this milk has to come out. Yeah. You see? Yeah. Sometimes you make sure you are expressing, you are feeling so much pain, but because you know the next level, you don't want to get there. Exactly. You have to work on this level as long as it is painful, and so that you can proceed well. So, people, those who don't understand that, they will see like this person is very rough, is not patient. Yeah. But we are trying to help before it gets to our situation. Yeah.
Okay, I would say, like you said, we are judged. Okay, the problem comes in with, at that moment, the mother is emotional. Yeah. And as we are trying to use logic, emotions and logic.
You already left your emotions.
Emotions are we are empathetic but not sympathetic. Yeah? Because if we become sympathetic, we are not helping these people. And I think that's why most people tend to have the notion that maybe the nurses are rude. But it's because we bring out the logic, we bring out the truth. Yeah. And at that moment, we don't want to be told the truth, and we don't want to hear the truth. Yeah. And before any management of not even a mother only, even patients from maybe other departments like the medical, one thing should be assessment. There's no way we can help you without assessing you first. So we have to check. You say, we ask you, bam, shida ni nini? Nasema, mi sina maziwa. We have to first check if kweli hatuna maziwa, because some say don't wana maziwa, but it's the white thing, the water thing, which is maziwa. And we encourage these mothers that even hiyo tu kidogo, hiyo white, hiyo colorless, that is what will bring this other milk. So we have to assess, and the only way of assessing it is kufinya kidogo.
Kidogo kweli. Okay.
Kidogo, so that we can help you in that. So I think it's whereby logic and emotions can't be housed in the same way. Then another thing we would usually encourage mothers and like to tell them, yes, enjoy the journey of pregnancy and all that, but also educate yourself on what to expect. Because many come into the maternity room, many come to the labor ward, they give birth, and they're blank. They don't know. We've only done baby showers, we've only done photo shoots, you know. We've had we've done shopping, everything, but nobody has read materials, nobody has gone to these prenatal classes of what to expect after delivery and newborn care. That's why you find mothers become blank, emotional, and they like, uyu hanifeel venye niko. They come. I know it's new for every mother. Some don't even know how to change a diaper. Go to these classes, but then they teach how to change a diaper. Some even don't know how a diaper looks. Wameionea tu pale kwa supermarket Pampers. Na wanazipita tu. Hiyo wanasema tutakutana nayo. So when that times come, it's so overwhelming to you. So what we tell these mothers, as much as you do these shoppings for babies, you go for these baby showers, you go for these photo shoots, go for these classes. Familiarize yourself. Go and visit a mother who has a newborn and see how things are done. Go and make yourself familiar. Go buy those diapers, open it. Siku buy peke na weke kwa nyumba. Useme nitaitumia hiyo siku ya fungua uone venye inakaa. What is front, what is back. Get these wipes. You know, read this material so that when you come to maternity, you don't become blank. So that when we give you the logic, usione kama tunakuonea. We really love these mothers and we really like to support them so much. Yes.
Okay. Another stereotype is that boys should not wear diapers. They should only wear nappies because watafinywa they are called alafu watashindwa wakigrow up they will be, you know,
important.
What would you say about that?
So far, I've not come across any research completely supporting that 100%. That babies who are raised with diapers, especially boys, end up to be important. And I think it's just a myth that goes around. Well, it can be scary, but for sure it's not supported. It's not supported by a research that this baby or this number of babies, when they grew up, they were completely important.
Because of diapers?
Yes.
Okay. And you have an addition?
I also not come across a research like that. When did which year were diapers introduced?
Okay, I don't know. But all I know is that when I was growing up, I used nappies. Now,
so maybe we can check the time the diapers got into the market, and if there were any men born at that time, and if they have children.
Actually,
then we come with that evidence. Yes.
Okay. The other one is mutumba clothes. You know, newborns should not wear mutumba clothes. Do you tell moms to go back home if they come to the hospital with mutumba clothes?
No, we don't. My children personally, they have worn mutumba clothes. Actually, mutumba clothes have good designs.
Unique.
It's just that you have to buy 2 or 3 from the shop, so at least kusurprise mtoto na kitu mpya. Kutoa mtoto hospitali. But once you just buy these clothes, you just wash them with the Dettol or Jik, then iron them. It's okay. Because if we say children can't wear mutumba clothes, what about these families who are not so well up and mutumba clothes is only what they, yes. And even if you say children can't wear mutumba clothes, it means the clothes that my children have, I can't give them to another child. It's still the same thing. It's just the way these mutumba clothes are coming from US. But we also have our own mutumba clothes that I've bought in the market and I've given my friend or my little sister to wear. Yeah, so
or your first baby used and now your
my second baby should not use.
Yeah,
you just wash them nicely. Make sure they are completely dry. Those which are ironable can be ironed. Yeah.
Okay. We also hear that nurses prioritize those moms who are accompanied by their husbands, to hospital. If a husband accompanies the mom, hata kama ni kucheck weight ya mtoto, au ndio sawa. Kujeni huko mbele, then the rest are told to maybe queue.
Okay, that's one. Personally, I have seen it.
Oh, you have?
In a public institution.
Yeah.
But the main thing, it is not stigmatizing. It is encouraging both parents to be there. It's like encouraging men to support their wives during the pregnancy or after delivery.
Yeah.
Because you'll find very few men
Yeah.
who come to the clinic to support their wives. Most of them, they are not there. But now, I saw that was long ago in that clinic. It was a public health facility. And that would encourage the women. If I come with a partner, the services will be fast. You see, even the others will be challenged.
Yeah.
But not all in all facilities actually.
Yeah.
Yeah, if you come alone, you are still attended to very well, very fast.
Yeah.
There is actually, the care is the same. You receive the same care.
Yeah. Okay.
The ministry realized that this journey, it's just the mother who does it alone.
Yeah.
Even in our parents' days and older parents, it's just the mother.
The business of the mother.
The spouse will just come and pay the bills and go.
Yeah.
So they decided so that men could come to the clinic and be educated in these things. Women who came with their spouses, who come with their spouses to the clinic, they are given first priority. So this man will come. By the even these services are faster. Hata next time nitakuja. Then this woman maybe hajakuja na mtu wake, maybe ataenda mwambie unaona hata baba so and so nilimuona huko clinic alikuja haraka wakaenda. So it was just a method to get the men be involved in this antenatal end. Yeah. So that even when the mother starts complaining of pain, wasianze kupanic kwa nyumba. Anamsaidia hata kupanga vitu, anaenda hospitali. When the child gets sick, the husband is aware of this and this. But even these women, maybe there are some who, unfortunately, maybe they are not married, but they are still given these services in a good way. And it was not about discriminating, but encouraging the boy child to be part of this journey. Yeah.
Okay. Is there any other stereotype maybe you would like to respond to?
Nurses really love patients. We really love our mothers, and they may find us strict because you see, we are dealing with two lives here, the baby and the mother, and if anything goes wrong, it's us to be answerable. In fact, we any maternal mortality, it actually goes to the Senate.
Okay.
We go to the Senate, we go to the ministers, we go to those big rooms to answer what happened to this mother. So they may find us strict, not to discriminate them or to pin them down, but it's because there are two lives online, and we are accountable of these lives. Yes.
Yeah, there's actually that of a father who was just outside waiting for the mother to come out of the theater. And there was no one to explain to the father what is happening. Okay, it became an emergency. So he was expecting that the mother will get the child very fast. So he stayed there, outside there for almost the whole day, waiting, and no one is explaining. Do you actually take time to, explain to the father what exactly is happening? The mother is in the theater. After the theater will take a few hours for recovery, and then you can find them in the ward afterwards?
Yes, we do. Yeah, it's one of the protocols to keep giving patients feedback on time, because once a feedback is delayed, anxiety. Yes.
Yeah.
And you'll find in most hospitals, once the baby is out, if the mother had already introduced the father to the team, or what, the father is called, sees the baby, even stays with the baby until the mother is out of theater. So we usually involve the spouse or the partner in this newborn care.
Yeah. Okay. All right. So before we finish, what now? Would you just mind telling us what success you have experienced so far as a midwife now, and maybe a challenging one that made you to shed tears even at home when you remember that case?
The successes, they are many. The success stories are many.
Yeah.
And one thing that I really feel good about is just a smooth delivery without complications.
Yeah.
That one makes you really happy.
Yeah.
You feel you've done something, and you are there, and you delivered what you could have. And then for the on the other side, there are also the downsides. Sometimes there are not many, but they happen. So sometimes there are these cases called emergencies. They are called obstetrical emergencies. They can happen to you, and they happen to us. So in such a scenario, you find that maybe you might end up losing a mom or a baby.
Okay.
That thing can really haunt you. You did your job fine, but you feel something went wrong. So before it gets out of your mind, then there's something called debriefing. Like you talk about it, what you could have done well, what went wrong, like that.
You talk to who?
You talk the team that was there. After
among
everything,
yourselves.
you talk. You talk. The relatives are appraised, but it can really make you feel down. It can give you a down moment for quite some time before you come up again. So there are people you don't know, but in the few minutes you interacted or hours, you have a very strong bond. So that one can really, you can feel detached. You can feel it's something that it didn't go the way you could have wished it to go.
You blame yourself.
Sometimes you blame yourself. Sometimes there is nothing you could have done.
It was out of your hand.
So you are left like, I wish it didn't happen, but again it happened.
Okay. Apart from the debriefing, do you do counseling? Maybe after? Is it recommended?
The counseling services in most of the institutions, yes, actually they are availed and they are free for the staff. So you can make arrangements. They are there. The counseling services are there.
So they are optional. I think they should be compulsory. Anyway, Angie, tell us about your success and maybe one challenge.
Success is, as a midwife, is just having, like she said, a smooth delivery, a happy mom and a happy baby. And one that has always lingered in my mind is there was once a mother who came, but she had issues with pressures. We call them preeclampsia and eclampsia. And these pressures were so high until she started convulsing. And her life was in danger. The unborn child's life was in danger. But everything was done, and we delivered a baby. The mother recovered. The baby was okay, and they went home. Wow. I think those are the things we say hata si ni Mungu tu. It is just God, bad days are those days either you lose a mother or a baby. In my shift, I've ever lost a baby when I was just newly employed, around 2017 there, and I think that I actually don't like to talk about it, but I think I've never healed from it. And
what happened?
I think
maybe you can talk about it today and then
today, but
to
it really haunted me. It really affected me.
Yeah.
Let's say it was just nature, maybe nature, or it just happened in my shift. Let's just say that I was a young midwife. I was newly employed, and you become confused.
Yeah.
And
introduction to
it was in 2018, 2019.
Yeah.
And it really affected me until when I was getting my firstborn. I would just feel like this child is not going to make it. This child is not going to make it.
Yeah.
If something wakinipima kitu iende mbaya, and I remember the time that I went through normal labor first, but did not go through.
Yeah.
From 7 a.m. till 7:30 p.m. and the heartbeat was going down, and sasa nikasema hii ndio nimepandishiwa. It is happening to me.
Oh, you blame yourself.
Yes,
that much.
It's those things, like she said, they really haunt you.
Yeah.
It is beyond you. You can't help it. Nature has taken its course, but because you were on duty, because you interacted with this mother or this baby, those things haunt.
Yeah.
Ni Mungu. God heals, time heals,
Yeah.
but does time really heal?
No, it doesn't.
Yeah.
It's only God.
It's only God.
Yeah. Okay.
But after that they make us strong. Yeah, because you can't quit.
Yeah.
You feel like quitting, but you realize even if you quit, utaenda wapi?
You've come a long way.
You've come a long way. No turning back.
No turning back. Wow. Okay. Thank you so much, Angie and Purity, once again, for coming to the show and talking about your experience as midwife nurse. I think we have really been waiting for these nurses so that they can clarify some of these things. And I hope that you have learned something from this video. Let me know on the comment section and also on my contacts that is going through on the screen. Before we finish this, I would like to give Purity and Angie a chance to do their parting shot and something you would like to talk to mothers and fathers. Parents, let's call them parents. Talk to parents.
Okay. To the parents, it's this journey of newborns, marriage. When it starts from marriage, I would encourage them to know that it's for the two people. It's not for one side actually. So if fathers can be present, if the situation allows, please let them support the mothers so that they are not so much drained, even at night. Just so those simple things, they make a lot of sense in the support of the mother, especially during the first week to the fourth week, sleepless night, fatigue. Just support where you can. So, and to the mothers who don't have the spouses, just find someone that you feel it is right with you, that someone will be there and they will offer the needed support, because when you are alone, it can be very overwhelming. Imagine for my case, maybe you are two and it's already overwhelming for the both of you. So when you are alone, it cannot go very well. It might end up even having things like depression, which is not good. You speak out, sometimes it is overwhelming, speak it out. If baby sleeps, take time to sleep, take good care of yourself, and take it easy. When you are in the hospital, learn as much as you can. Ask the nurses, what can I do about this? Before you go home, when you are alone, use that chance. Question everything. Know everything about the baby. And talk to people and don't take it like this is my burden, I should take care of it alone. No. Look for help and it will be easy.
Wow. Thank you, Purity.
I would say motherhood and parenthood is a journey, so ask for help when need be. Don't be afraid to ask for help. Like she has said, if it can be overwhelming to us nurses who know the physiology and all those, what about a layman person? So we know it's usually overwhelming. but ask for help. I would also encourage the partners or the family members to be of great support to new mothers, or not even new mothers, to anyone who has a baby, because mostly we find the second child is not like the first child. The experiences are different, and not to judge everything they do. You just judge or offer excessive advice. Just be of good support. Mothers also, make yourselves familiar during the prenatal journey on what to expect after delivery, through materials, through the prenatal or antenatal classes, or even visiting mothers who have given birth. It will really help a lot. We were happy to be hosted by Frida Wesonga. She has been, we knew each other in high school, and it is good to be thought of after that we can be help to the community. Yes.
Thank you so much once again, Purity and Angie, for gracing our show today. I have really learned a lot. First of all, fathers, please don't be left behind when your wives go to hospital. Accompany them, do as much as you can, offer a lot of support, because this is your journey together as parents. And secondly, familiarize yourself with all this content. Watch, learn from other mothers who have children, learn how to tie diapers, learn everything on how to take care of newborns and even secondborns and thirdborns. Let's learn, because all these avenues are there for us to learn. And we will not be clueless, we will not find as if nurses are, harassing us, because we already know that they are actually helping us. So thank you once again for coming. I hope that you have learned something today. Let me know in the comment section below. I would also like to say that I'm shooting this video in Breastfeeding Mission Church. It's a church in Dogoto, Kikuyu, Kiambu County. And here we believe that God writes beautiful stories. So if you're looking for a church and you're around Kikuyu, Bypass, Karen, all these areas, you're invited and you're welcome to come and enjoy the fellowship of brethren. For now, I would come to a close.